Pulmonary hypertension refers to a condition where the pressures inside the lungs are elevated. One of the things that happens in this condition is that the right heart starts to fail. And when that happens, the pressures back up, not only from the lungs, but into the heart and then throughout the body.
There are 5 different categories of pulmonary hypertension. The fourth group is labeled chronic thromboembolic pulmonary hypertension. And that involves a group of patients who have had a blood clot in the lung circulation, what's typically called a pulmonary embolus. And often the patients are symptomatic, short of breath, fatigued, even at rest.
My name is Floeckher. When I was diagnosed, I had a lot of shortness of breath. At one point, I could not walk 10 feet from my bedroom to my living room without running out of breath. Putting on a pair of pants would knock me out for the rest of the day.
When a physician in a pulmonary or cardiology practice sees a patient like that, particularly if they're young, one of the things that they immediately think about is the patient's going to need a lung transplant or a heart and lung transplant, prompting a referral to the Mayo Clinic. Our transplant team, along with our subspecialty teams, are very good at stepping back one step. There may very well be medical or surgical therapies that do not involve transplant that could improve the patient to such a degree that they're functional again, that the heart size is more normal, that the heart function is normal.
Nice to see you.
The Mayo Clinic is uniquely positioned to care for people like Laura. We are one of the few centers in the country where we've assembled a team of people dedicated to this uncommon but very significant disease. There were no medications that could reverse this condition. In fact, the only cause of pulmonary hypertension that is curable by an operation. The procedure that we performed on Laura was a pulmonary thromboendarterectomy.
He told me how big the mass was. It completely blocked my artery, and it was about the full length of the artery.
So the good news is we've removed the majority of blood clots and the scarring that resulted from her lungs, allowing her lungs to improve and the pressures in her lungs to go down and her heart to function in a much more efficient and normal way.
So getting the correct diagnosis with a team approach of experts, directing the patient into the proper course of treatment, and for those subset of patients who turn out not to need a transplant, it can be very rewarding because their lives are now changed for the better.
I didn't think I would ever get back to feeling myself again. You know, when you wake up in the morning and you can get dressed, you can walk from your bedroom to the kitchen to the living room. I feel normal. That's all I can say, and don't take it lightly. It's incredible to feel like I can do it all.